Hey guys, it's the Fibroid Doc, and today we're going to talk about the difference between a Pap test and a pelvic exam. A lot of women think that these are the same thing, but that is not the case. A few years ago, the Pap smear guidelines have been relaxed, and now you need a Pap test only once every 3 years. And so a lot of women stopped going to the gynecologist every year. And they said, well, I need a PAP, I need a PAP only every 3 years. So I'm just going to go to the gynecologist every 3 years. But you're actually missing out on the pelvic exam that is recommended every year. So what is the difference? A PAP test is a procedure where we use a speculum. This is a speculum used for the pap. We put this inside the vagina, open it up, and take a little scraping of the cervix and send it to the lab to make sure that there are no abnormalities. And this is a screening test for cervical cancer. A pelvic exam is an exam where your doctor will place his or her fingers inside the vagina and one in the lower abdomen to feel the uterus and the ovaries. And this exam is checking for other abnormalities of the pelvic organs. Maybe your uterus is enlarged. Maybe you have fibroids. Maybe there's an ovarian mass or ovarian cyst. Maybe you have some pain on top of your uterus that could signal infection. So there are a lot of other things that your doctor can pick up during a pelvic exam. Now, along with feeling your uterus and your ovaries, during a pelvic exam, your doctor will often do a speculum exam. So we put the speculum in, take a look at the cervix, take a look at the vaginal canal, see if there's any discharge, see if there's any abnormalities. And so a lot of patients get confused when we put in the speculum. Oh, they must be doing a PAP. But that is not the case. The PAP, again, is where we scrape the cervix to take some cells. So when you go to your gynecologist, be sure to make sure, know when you're getting a PAP, so if it's every 3 years. So maybe this year, if you got it, next year you won't, but they're still going to do a speculum exam. They're still going to do a pelvic exam. So keep a record of when you're actually getting your PAPs. And regardless, it is recommended that you go see your gynecologist every year for a thorough pelvic exam.